Cardiac Hospital, New Delhi, and
Can you see
she
my
is very
slide?
helpful.
Sorry, can
Yes,
you see
ma'am.
my slide? Okay.
Yes,
Okay, then
ma'am.
I'm starting.
Okay,
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 I'm
ma'am.
starting.
Please.
Okay, thank you very much. I'm Dr. Navin Chand. Welcome, my respected teachers, colleagues, and all the participants to this session. My topic is sudden cardiac death in young. Sudden cardiac death is natural death due to cardiac cause, heralded by abrupt loss of consciousness within 1 hour of the onset of acute symptoms, as in an individual with or without known pre-existing heart disease, but in whom the time and mode of death are unexpected. The incidence is 1.7 per 1 lakh person years. Then what are the causes of sudden cardiac death? Cardiovascular malformation, other structural heart abnormalities, or primary arrhythmias. My first case is Kawasaki disease. Here we can see in a 3-year-old child dilated coronary arteries. So causes of sudden death in this case is myocardial infarction due to rupture of large coronary artery aneurysm or due to thrombosis. My next case is 12 years old female with syncopal attack and dyspnea on exertion. Saturation was 88%. Apical 4-chamber view showing there is displacement of the septal tricuspid. So it's Epstein anomaly. Causes of sudden death in Epstein is tachyarrhythmia and SVT. See the ECG, there is delta wave. My next slide is, next patient is anomalous origin of the left coronary from the pulmonary artery. We can see that the coronary arteries are arising from the pulmonary artery. Here we can see from the short axis view, coronary arising from the pulmonary artery. This is the 4-chamber view showing the LV dilated with papillary muscular sclerosis with PFO with dilated LV. So causes of death in Al-Kappa is acute myocardial infarction or coronary steal. My next case is right coronary artery originating from the left sinus. Here we can see right coronary arteries arising from the left sinus. He is a 25 years male, history with chest pain during exercise. My next case is right coronary artery originating from the left sinus and passing between the aorta and RVOT seat, and there is compression. So during exercise or immediately after exercise, sudden death occurs. My next case is 19-year-old girl. She came with chest pain fever. Here we can see ascending aorta is dilated. She had bicuspid aortic valve with severe aortic stenosis, and there is also flap is also seen. So here cause of death is aneurysm or rupture of the aneurysm. My next case is very common hypertrophic obstructive cardiomyopathy. We can see 2D echo in the short axis view showing diffuse concentric hypertrophy, and this is the 4-chamber view showing severe mid-left LV mid-capillary obstruction. So in syncope, sudden death. And the primary risk factors we have to identify by genetic counseling. So my next case is rhabdomyoma in a small baby. She came with congestive heart failure. She died immediately after admission. So causes of sudden death in rhabdomyoma, it is present also in adult case. If the rhabdomyoma extends into the LVOT, so there will be, then in that case there will be sudden death. My next case is aorta-left ventricular tunnel. It is extracardiac channel that connects the aorta above the sinotubular junction to the left ventricle, right ventricle, or to the RV. So here we can see the aortic root angiogram showing the tunnel is connected to the LV. So what are the causes of cardiac death in this case? Compression of the coronary arteries associated with left ventricular obstruction. My next case is aorto-right ventricular tunnel. Here we can see the tunnel entering into the right ventricle, and she had continuous murmur. We can see continuous flow. And then my next case is 25 years old male. He came with evolution of disease, spell, and some syncope episode with retrosternal pain during physical stage. Here we see the ECG, there's ventricular tachycardia. Also, epsilon wave was present in V1, V2, V3. So to diagnosis, confirm the diagnosis, we did the CMR. CMR is showing the RV wall is acenotic with outstretched pouching in the lateral wall, and also fatty infiltration of the RV lateral wall. So diagnosis of ARVD was made based on ECG features and structural abnormality. Causes of sudden cardiac death is ventricular tachyarrhythmias or heart failure. My next case is a
Ma'am, time is short.
17 years.
Please.
17 years old male with chest pain. This is a mitral aneurysm. Cause of death is arrhythmia thrombus. My next case is a congenital corrected TJ. Saturation was 84. So this is congenital corrected TJ with right to left with Eisenmenger. Cause of death is AV conduction disturbance with heart block. Next case is Turner syndrome with short structure. So here we can see there is coarctation. Causes of death is rupture, dissection or rupture. My next case is familial thoracic aortic aneurysm. We can see the true and false event. The patient died, his father also died. My next case is Marfan syndrome with Takaisus arteritis. And aortic root dilated with I got high gradient from the descending aorta. My next is trough repair. In case of trough repair, sudden death can occur. So, other causes of supravalvular aortic stenosis, Bugada syndrome 1, 2, 3, short QT, long QT, WPW syndrome. So we have to investigate. Family history is very important. Cardiovascular screening checklist for the congenital heart disease in the young. These are the tests. Prophylaxis is the ICD, but not possible in case of pediatric. So take home message. Sudden cardiac death in young person is rare, even it is traumatic. It is important to recognize which young patients actually benefit from primary prevention. Thank you. Thanking you all for patient sharing. My deepest sympathy goes to the doctors who died due to COVID-19 and my prayers for the doctors who are still fighting. Thank you.